Okay, Michael Tapes here. Week one is complete. So I started my radiation on Tuesday, had radiation every day, and then had radiation on Tuesday, but in addition had chemo on on Friday, my first chemo. So this was really my first week through the process, and I'll try to take you through it. So radiation, this is, I don't know, somebody put on a little art festival with some positive imaging. It was gone the next day, so it was a one-day affair. But anyway, bottom line is I'm doing great. This is Sunday, so I have my chemo on Friday. This is the day that the chemo was supposed to hit me. I don't have any nausea. I am fatigued, but who isn't with COVID and everything that's going on? So I don't know, how much is fatigue, how much is I'm tired, how much is COVID or whatever. But we're all struggling with this. And a shout out to my niece Lauren, who still is struggling with her COVID diagnosis. She's not getting worse, but not getting better. So she has symptoms. She's at home, and it's she's tested positive, and it's a scary situation. So my love and prayers go out to her and everybody else who's struggling with their situations in this. It's an interesting situation. Excuse me. Is that for me and many others who have a sort of a horrific event, in my case, the cancer diagnosis happening right on top of the COVID, where you can't separate them. So I was diagnosed on my birthday, my 70th birthday, January 30th, right when COVID was hitting the news. So as I investigated my cancer diagnosis, COVID was moving along. So they're, lockstep. So forever COVID and cancer, locked for me as other events are for you guys. And I know some of you are suffering, far more than I am and have better, not better, bigger hardships, whether they be financial or medical or mental or what have you. So I'm doing pretty good. I'm a little fatigued right now, but that's nothing major. Okay, so this is my first week. So the radiation is, let's see if I can just take you back to the radiation machines. Yeah, so the this was the simulator machine. The machine that I'm on is looks very similar, but it's bigger, and it's actually able to do a CAT scan and do the radiation. So actually, what happens is um, they line me up with the lasers and all that stuff, the tattoos and all this stuff. So they line you up. The mask is holding you down, and then you go into the tube, and they do a CAT scan. And then what they do is they overlay the CAT scan. Let me move forward to that. So they overlay the simulation, the original CAT scan, with the one that I'm getting today. And even after they do the mechanical, laser beam, whatever, situating me properly, they then do a CAT scan, and like in Photoshop, where you would take two layers and diminish the opacity in one, and move the layer to align it manually. That's what they do, and then they send that information into the machine. So in actuality, there are two scans done. The first is a CAT scan. They pull me out. They don't move me, but the tray, the platform moves out. They come onto the computer, they align everything just like you would in Photoshop, and then those adjustments, and I can feel the platform move a little bit as it makes the subtle adjustments to align my physical body directly to what the simulation and plan was, and then I go back in for the radiation. Each of those takes about 5 minutes. So the actual radiation situation is about 5 minutes, 5 or 10 minutes to get situated on the table and locked into the lasers and all that stuff, and then 5 minutes for the CAT scan, and then it comes out for about 5 minutes, and they do their adjustments on the computer, and then I go back in for the X-rays for the actual radiation, and then I'm done. So I imagine that the red is the highest intensity radiation. I'm just guessing. I don't know what any of this means, but you can see how it's actually, going much more than my tongue, going out to here. I don't know how far out the lymph nodes are, and you might be able to see if these are my teeth, my lower teeth, and this is where they took them out. You can see why they wanted to take them out, because it's right in the heavy radiation path, if I'm reading this correctly. But of course, I don't know what I'm reading. And this is just another view. And all right, that's for the chemo. So anyway, so this was the radiation, and so we move on. This is me at chemo. The chemo, I have to get a blood test. They draw blood in the morning. I go in, get the IV put in, and they draw blood. I'm not using a port because I only have 7 of these chemo treatments. So I figure I can, with my veins, can withstand 7 pokes once a week to do this, and I'd rather not get involved with the port if I can help it. So they have a nice setup. Everybody is extremely nice. This is the room that I'm in. So there are 4. It's called a pod. And there are 4 of us in the room at this point. I guess I took this picture right before I left. So this is one station. This is another station. I'm in this station, and there's a station next to me. This is the nurse who's taking care of all 4 of us. And of course, these are the IV machines that are affecting the drips of the various chemicals that are coming through. It's a multi-hour process. First they have to flush my kidneys, then they have to give you anti-nausea medicine and some other stuff. In this case, my blood work showed my potassium was a little high, not high, but on the high range of normal, so they didn't give me potassium, which normally they would. In any event, so there are 3 basic infusions. One is, or 4. One is the wash with saline, then they add the not the chemo agent, but the anti-nausea and that kind of stuff, and whatever potassiums and things they have to do to balance your system, because they just did the blood work. So there we see the pod. There's my IV. Here's my machines with the various bags. The chemical I'm getting is called cisplatin, and you can see it. I don't know if I can zoom into this, but yeah, cisplatin. So that's what I'm getting. And then, of course, what I'm not getting, but they had planned, but it didn't seem like a great idea, was this. But at the last minute, they decided not to use that for some reason. I'm not exactly sure. But anyway, so there are my machines at various points, and there's my some of my bags, and there I am. So in any event, it was easy. I was there for maybe 3.5 hours. So it's a long day. I leave my house around 8:30, and I got home around 3:30. And the drive up each way is an hour. The what I had heard is that the second day after chemo, which would be today, Sunday, I got chemo on Friday. That Sunday would be my bad day, and I would be either super fatigued or nauseous or what have you, and I'm none of those, so I'm very pleased for that. I'm slightly fatigued, but again, who knows if that's just the stress of COVID, the stress of my cancer. Everybody's fatigued and whatever, so I'm doing fine. And that's pretty much the scoop. There were some other things I wanted to tell you, but I probably forgot. And anyway, I'm doing great. I'm grateful. So tomorrow starts the process all over again. 5 days of radiation, 1 day of chemo within that 5 days. So Monday through Thursday is radiation, and on Friday is radiation and chemo. And I see doctors in between and so forth. Oh, and I got my fluoride trays, so I have a full regimen. Every hour I have to rinse my mouth with a different rinse. I have to prepare it and mix according to instructions. And every night I have to do a 10-minute. I have trays that I put fluoride in, put those in my mouth, keep them in there for 10 minutes. And that I'll be doing for the rest of my life, because after this radiation, your teeth are in really bad shape and you don't want them to have decay and that kind of stuff. Other than that, I have no medications that I take at home. I would imagine once the no, I have pills to take for nausea in case it comes, but so far it hasn't come. And I imagine when pain starts coming in from mouth sores and so forth, I'll be taking those medications. But other than the chemo, I'm getting no other medication. The radiation is what's supposed to be killing the cancer. In any event, let me wrap this up and say I'm a lucky person that this is going so well. I feel blessed. And everybody out there, stay safe. And my hearts and prayers are being sent out to you guys, because we're all sort of in this together. And I got an extra little hitch, but probably each of you have your own little extra hitch. So until next time, I'm doing good, and thanks for your support. Bye bye.